We did our presentation of COVID in Australia by Lyric Run, Jessi Gray,
and Drew Martin.
Epidemiology. The cumulative cases in Australia was 26,942 confirmed cases and 854 confirmed deaths. Population adjusted estimates, they expected a 78% decrease in March of cases, but then received a major increase in March and July. The trends in cases/deaths over time. There was a surge of cases in March and April of 400 cases, and then over 800 cases in July through August. The mortality estimates. Australia has had the least amount of COVID cases in the world, but a recent surge in a city named Victoria announced a state of disaster recently. Statistics by age/gender/race. As of August 6, 2020, the number of females 20 to 29-year-olds diagnosed with COVID-19 in Australia had reached 2,282 people. At the time, children under 10 years of age had the fewest number of confirmed cases.
Okay, the second slide we have is the medical and public health analysis. Okay, so the first question we have is, what is the cost sharing scenario? In Australia, healthcare is becoming extremely less affordable, and on the average, Australians pay about 17% of their healthcare out of pocket. The facilities required to care for COVID patients include places like hospitals, regular healthcare facilities, and clinics. Access to basic medications. These are pretty easy to get if you are if you have COVID. And in Australia, they use something which is called the triple therapy, and the number one medicine they use for COVID is ivermectin. PPE supply for healthcare workers, which is like the stuff they use to protect themselves, which is the mask, respirators, face shields, gowns, and also gloves. The availability for COVID testing is very easy to come across. To get tested, you can go to free respiratory clinics. You can either call your doctor to set an appointment, and there's also drive-through testing like they do here in America. Contacts, tracing, capacity efforts. This means the rise of case numbers in Victoria is rising so quickly that contact tracing can no longer be relied upon to unearth all potential clusters in the state. The quality of reporting/surveillance. Australia has reported its first day without a COVID death in 2 months as of September 15th, and this is due to more civilians reporting their cases, which means the patients have been safer after they have contracted the virus and have not infected anyone else.
Response and community response. Government levels and policies and regulations. The Australian government aims to minimize the number of people becoming infected or sick with COVID-19. They plan to manage the demand on our health systems, manage the mortality rate, help you manage your own risk to your family and community. They also work to support towards a vaccine, which they will eventually want to make vaccines free to Australians. They are securing early access for the University of Oxford COVID-19 vaccine. If the trials prove it to be successful and safe, They are delivering a 17.6 billion economic support package to encourage investment and keep people in jobs. They are providing a $669 million to expand Medicare subsidized telehealth services. They are giving support to Australians experiencing domestic, family, and sexual violence due to the fallout of the coronavirus. They provided $48.1 million for the National Mental Health and Wellbeing Pandemic Response Plan, in addition to $74 million to support the mental health and well-being of the Australians. They are funding home delivery of most prescription medicine for those unable to get to their local pharmacy, ensuring the healthcare professionals are protected with adequate supplies of PPE. The health disparities and social impacts of pandemic. Have specific subpopulations been more heavily impacted than others? The city of Victoria has been impacted more because of travel than other parts of Australia. There has also been a recent surge in Victoria. The impact COVID has had on Australia's economy. Thousands of Australians were stranded overseas due to the impact of COVID. At first, Australians was stockpiling groceries. Shopping centers are now deserted, and retail sales are down by 20%. Online sales have been spiking due to this. Originally, the shutdown was supposed to last 6 months, but now it is only supposed to last 2. The government will either raise taxes or cut spending to make up for the economic debt COVID has caused. The public debt is a lot shorter than that of Japan, Europe, and the US. The impact COVID has had on Australia's education. It has been predicted universities will lose $18 billion by 2024 from COVID without a vaccine. They have been relying on international student fees to fund teaching, research, and infrastructure programs.
Evaluation and recommendations. What has gone wrong or right in Australia? The early physical distancing measures, repetitive COVID-19 testing, social distancing, and taking other precautions early has helped them tremendously in preventing the spread of COVID-19. What is the perceived level of effectiveness of Australia's response? The effectiveness in Australia's response is high because the level of low cases in this country proves this. How well coordinated has the response been? Australia's COVID response has been very well coordinated. Australia took charge in early January when first hearing about COVID-19, and their worries have slowly went down. How well has it been implemented? The response of COVID-19 has been implemented well, and the Australian government has strictly applied rules and regulations like social distancing, wearing your mask, and all these other things that we were supposed to do. What are the ongoing challenges of fighting COVID-19? At this point in Australia, there are none. Australia has the lowest number of COVID-19 cases and will continue to decrease throughout the year. What can we learn from their response?